Good afternoon, everybody. My name is Nicole, and I'm currently a social worker in the outpatient neurology clinics, specifically with ALS, neuromuscular, and epilepsy here at South Health Campus Hospital. I've been asked today to speak about financial resources associated with illness and disability, advanced care planning, and goals of care. As you're aware, this presentation is being video recorded, so if you could please leave your questions to the end, that would be greatly appreciated. You can also come up and chat with me after if you have specific questions that you don't want everybody to hear, so I can stay behind for that as well. Most of the information that I'll be presenting about today is from the Service Canada and Government of Canada websites. All the information that I'm talking about is up to date to the best of my knowledge. However, qualifications, eligibility, processes, all of those sorts of things are changing all the time. So if you're needing the most current up-to-date information, I would just double check the websites as needed. The short-term and long-term disability is sort of where people start when they're looking at financial resources due to illness. So they're usually through your work, and you have to contact your employer or your human resources representative to obtain these documents. These documents are either emailed, faxed to you, you can pick them up, anything like that. Most of the time there's two parts to these documents. There's the part that you fill out as the patient, and then there's a medical report. The medical report is to be completed by the physician who best knows your medical condition that's preventing you from working. The documents are then sent back to your employer, human resources, wherever you got them from, to be completed. And just so you're aware, the medical forms, depending on the doctor and where you're getting the forms filled out, there may be a cost that you're responsible for paying for on your own for these medical reports. The next step is employment insurance. So there's three parts to employment insurance. There's regular benefits. So this is if you've lost your job to no fault of your own, so you haven't been fired or anything like that, you're laid off. There's compassionate care benefits, which are only for someone who's looking after someone that's dying or at the end stages of their life. And then there's sick benefits. And for the purpose of this presentation, I'll just talk about EI sick benefits. So these are temporary financial assistance to employed and unemployed workers due to sickness, illness, injury, or quarantine. These are only short-term benefits, and the maximum amount that you can receive is 15 weeks. So EI sick benefits eligibility. If you've been deemed unable to work due to your illness or disability, you are employed in an insurable employment or already receiving EI regular benefits. Your normal work weekly earnings have reduced by more than 40%, and you've accumulated at least 600 hours of insurable employment during the qualifying period. You can apply for EI sick benefits online at Service Canada website. You can't mail them in anymore, so this is the only way that you can do them. If you have questions about EI, you can call the 1-800-206-7218 phone number. You will need a medical certificate signed by a doctor, and you have to sign it first to provide consent that your doctor can fill out the paperwork. And again, there might be a fee for this depending on which doctor you are getting to sign your document. You also need a record of employment, which your employer can send directly to EI. You should apply within 4 weeks of your last day of work, even if your employer has not yet issued your record of employment. If you wait, you could risk losing benefits, so just be aware of that time frame. In most cases, before you can start receiving EI benefits, there will be a 1 to 2 week waiting period in which you will not be paid. Everyone earns a little bit different due to their income amount, but the rate of calculating EI benefits is 55% of your average weekly earnings. And please see the Service Canada website for updated earning charts and information. If you become ill or injured for more than 4 consecutive weeks while you're receiving EI regular benefits, then you can convert your benefits to EI sick benefits. Another thing to be aware of is sometimes people have insurance through like their visa, their bank, mortgage, areas like that. And these are usually for if you're needing to be off work for an extended period of time or permanently. You can contact your bank or your insurance company to see if you've already opted into these things or been paying into them. There's a lot of different kinds, so I can't talk about all of them because every company is different, but just to be aware, this might be something that you've signed up for a long time ago that you kind of forgot about. So if you do, just contact your bank or whoever it is that your insurance might be through, and again, they should send you 2 documents, one that must be filled out by you, and the second that must be filled out by a doctor. And again, this should be done by a physician who knows your medical condition the best that's preventing you from being off work. When these documents are completed, they can be sent to the address identified on the application. And again, maybe a cost for the medical depending on which doctor is filling it out. Please make sure to pay attention to the deadlines when it comes to these applications. Most of them have time frames as to when you should be applying, and otherwise you may lose out on your benefits. The ones that I've seen in most circumstances are between 30 and 90 days, and I have not seen options for late applications. So just be aware that if this is something that you do have, to be cognizant of the time frames. Some people even have critical illness insurance, and this is also private. It's just something to be aware of, and you would have had to sign up before an illness. So just be aware that that might be something that you have as well. The next program is the Canadian Pension Plan. There's 2 parts to Canadian Pension Plan. There's Canadian Pension Plan Retirement and Canadian Pension Plan Disability. The part that we'll be focusing on is Canadian Pension Plan Disability. Canadian Pension Plan Disability is a long-term disability insurance program. It is for people who are not able to work because of severe or prolonged disability. According to CPP, severe is defined as having a mental or physical illness that regularly stops you from doing any sort of sustainable work. And prolonged is described as long-term and last indefinitely or likely to result in death. You should receive a determination regarding your Canadian Pension Plan Disability application within 120 calendar days of your submission. The most important thing to consider if you're thinking about this program is if your disability is severe and prolonged. If not, this probably isn't the program for you, but you need to have a doctor also agree with that prognosis as well. So eligibility. You must be between the ages of 18 and 65. You must be a valid contributor to Canadian Pension Plan, which means that you've worked 4 out of the last 6 years, or 3 of the last 6 years if you've contributed to Canadian Pension Plan for the last 25 years. Have a disability that fits the criteria of being severe and prolonged, and you cannot have been found to be disabled earlier than 15 months prior to the date of application. So again, don't wait too long because you could lose out on your benefits. If this is the case, though, they do have a late application provision, so just refer to the website if this is where you find yourself being. If you are on Canadian Pension Plan early retirement before becoming disabled, then you can apply for Canadian Pension Plan Disability. But if it's been longer than 15 months, again, you could lose out on the benefits, but you could try the late application provision as well. Your eligibility is based on contributions and your disability. And there is a 3-month return to work trial. So if you're trying to get back to work, but you don't want to lose your benefits, they kind of give a 3-month period to see how things are going, kind of report back to them. And if you're able to work, great. And if not within that 3 months, then your benefits can continue. If you are denied Canadian Pension Plan Disability and you're 60 years of age, you can apply for Canadian Pension Plan early retirement, if that's something that you're interested in. And being on Canadian Pension Plan Disability will not affect your Canadian Pension Plan retirement benefits once you turn 65. Applications for Canadian Pension Plan Disability can be found online at Service Canada website. You could also call them and ask for a package as well. There are a lot of parts to the application, so please make sure to read the website carefully and make sure you have everything you need for the application. If you don't, this can cause delays in the process. For most people, there are 7 parts to the application, but if you have If you don't have children, then it is a little bit shorter. And make sure that there's also a consent that needs to be signed before your doctor can complete the medical. If you have questions or you need to ask for a application, you can call 1-800-277-9914. Sometimes it is best to just phone and ask for an application, because then you know it's all the parts that you need are in there and you won't miss something if you're printing it off the internet. So the monthly amount that you can get on Canadian Pension Plan Disability will be different for everyone based on your contributions and any other government funding that you're receiving at the time. If you are receiving Canadian Pension Plan Disability when you turn 65 years old, your benefits will automatically convert to Canadian Pension Plan retirement. So again, the medical must be completed by a doctor that knows your disability that's preventing you from working the most. And again, there may be a fee for the medical report. The benefits are taxable. It's very important when you're filling out these applications, especially Canadian Pension Plan and AISH, to be as detailed as possible. They don't get to see, the person reading your application doesn't get to see what your day-to-day life looks like. All they get is a snapshot of what you write on this piece of paper. So there is one section in the Canadian Pension Plan Disability where you write down exactly what areas are being affected in your day-to-day, and they kind of talk about hearing, sight, walking, standing, lifting, all of those sorts of things. A lot of times when I'm looking over applications for people just put unable to stand. It's really important to write down why, what will happen if you stand for a long period of time, how long you're able to stand, just be as detailed as you possibly can. And same if there's one about lifting. So if you're unable to lift, why? Is it because you can't bend down? Does it have to do with your balance or leg weakness or something like that? So just remember, detail is important. And when you're filling out these applications, it's important to think about the worst days that you have, to come up with examples and things that are the most challenging things for you. The next program is AISH. AISH stands for Assured Income for the Severely Handicapped. This program provides financial and health-related assistance to eligible adults with a disability. The health-related assistance covers some ambulance bills sometimes and eligible medication coverage. And again, just like CPP, AISH has their own kind of terminology they like to use. You must have a disability that is permanent and severe. This is really important to consider when applying, because even though you have a disability, it doesn't necessarily mean that it fits a criteria for AISH. So just be aware of that if you think that this is a program for you. So eligibility. Again, you must have a severe handicap that is permanent and substantially limits your ability to earn a living. The disability must be your main factor as to why you cannot work. So it can't be your age, lack of education, or available jobs. That would be a reason why you can't work. There must not be any training, rehabilitation, or medical treatment that would help with the improvement of your medical condition. Your income and the income of your cohabitating partner must not exceed the limits allowed under the program. Your assets and the assets of your cohabitating partner must not exceed the limits allowed under the program either. You must be between the years of 18 and 65 years old. You must be a permanent resident of Alberta. And you must have also applied for other eligible financial benefits as well, which include CPP. If you are eligible for Canadian Pension Plan Disability and you did not apply, AISH will likely reject or delay your application. So make sure to apply for both if this is what you're going to do. And you must have signed the consent for AISH and CPP to speak to each other. When it comes to the medical reports for Canadian Pension Plan Disability and AISH, make sure to have your doctor include any medical documents like tests, consult reports, anything like that that kind of verify and reinforce what the doctor is writing on your medical. They always ask for lots of information, so the more you can give, the better. You can apply for AISH by printing the application online at the AISH website or calling AISH to get them to send you an application in the mail. Again, same as Canadian Pension Plan Disability, very lengthy, and so sometimes it is better just to call to make sure that you have all the pieces that you need rather than printing off bits and pieces on the internet and maybe missing a couple pages. When the application is finished, you can drop off the application or mail it, and all of the office locations are online. Make sure to print off all the documentations and follow the checklist. They have a really good checklist on all the things that you need to ensure that your application is correct. And if you don't, it could cause delays. If you have questions or need to order a AISH application, you can call 403-297-8511. And you can refer to the AISH website for updated eligibility requirements regarding income and assets. If you are denied AISH, there is an appeal process, but please be aware of the timeframes. If you are out of those timeframes, it is incredibly hard to get your application to be looked at again, otherwise you have to start from scratch. If you don't have all the parts of your application, this could cause delays, and it is best to send in everything that you can all at once. I know some people are waiting for income tax reports and all of that sort of thing, but if you send in little bits and pieces here and there, you risk that things will get lost. So I do suggest that you try and complete the package to the best of your ability before you send it in. Again, you are responsible for paying for any medical reports that the doctors charge for. And you also need to have a doctor that agrees with the fact that you have a prolonged and severe illness. If not, you might want to look at other applications or other funding, because that part is the most important part for this program. The income of your partner, like I said, will affect how much you get if you do get approved. And this will also, the amount that you get on AISH will also change based on what you're getting for Canadian Pension Plan Disability. So I think one of the most helpful hints that I've come across when it comes to Canadian Pension Plan and AISH is just because you get diagnosed with an illness that might be permanent and slowly progressing doesn't mean that you can apply for these programs right away. Sometimes you have to look at changing your line of work, modified duties, all of those things before applying for AISH. Another program that we have here is Alberta Works, and this program assists with employment and training services, income support program, child support services, and adult health benefit, which is just a fancy word for medication coverage. This program is for people who cannot work due to chronic health problems. They're looking for work, working but not earning enough, or temporarily unavailable or unable to work. The program also can help with if you're faced with an unexpected one-time emergency of no fault of your own, which means utility disconnection, emergency medication coverage, and those sorts of things. You must be an Alberta resident or be over the age of 18 to apply for Alberta Works. A medical letter is required if you're unable to work due to medical condition. Alberta Works will consider your RSPs of yourself and your partner, any assets, money in the bank, those sorts of things to determine eligibility. You can apply by going to an Alberta Works office, and it is a first-come, first-served basis. So if this is something you're doing, make sure to show up on time or a little bit earlier. You can get applications online, and if you are going to go to an office, I would suggest having your application completed and having all the financial pieces that they ask for, just so you prevent any delays in your application. If you have any questions, you can call Alberta Supports, which is 1-877-644-9992. So just sort of some helpful hints, recap of the financial supports. I think something that's really important so you don't get in trouble is if you're in receipt of any other government-issued financial benefits, you must inform the programs that you're applying for of all your income. And even if you're on something and something changes, you must inform them. If you have access to a social worker through your clinics and you're needing assistance with applications, not quite sure what to apply for, that sort of thing, you can request to make an appointment with them. Social workers are not financial planners, but we can definitely help direct you to some things that might be beneficial for you. If you do not have a social worker through your program, you can go to community resource centers. They often have social workers attached to them as well that can help you. Or you can call the phone numbers that I've listed if you have any questions or concerns. Generally speaking, in my experience, most people are on disability through their work or EI and then end up applying for Canadian Pension Plan Disability. If you're lower income and you fit the asset level, then people will also apply for AISH as well. So those are sort of the main programs that people apply for. Be aware that for all of these programs, you must have your taxes done and up to date. Otherwise, you will not be eligible for any of these programs. The last thing to consider that I forgot to put in here is the disability tax credit. It is a non-refundable tax credit that helps people with disabilities and their supporting persons reduce the amount of income tax they have to pay. Individuals may claim the disability amount once they are eligible for the disability tax credit. You're eligible for the disability tax credit once you have filled out an application and you've been told that you are approved. Again, a medical must be done and you may have to pay for it. And same thing, severe and prolonged impairment due to disability or illness. If you're needing more information, you can go to the Government of Canada website. For those of you that are over 65, a lot of these programs do stop when you turn 65, and then you're eligible for all of your other pensions, such as the Canadian Pension Plan Retirement, Old Age Security, Guaranteed Income Supplement, and Alberta Seniors Benefit. So that's kind of a quick recap of all the financial things that are available for you. The next part that I'm going to talk about is advanced care planning. So this is something that I suggest that everyone has that is over the age of 18. It's especially important to have these documents completed for those of you who are more involved with the medical systems or have ongoing medical concerns. There's 3 parts. There's a personal directive, and this is the document that gives you the ability to name an agent who is someone that you trust to make medical decisions if you're unable to make them on your own. So medical decisions under the personal directive counts as healthcare, accommodations, with whom I may live and associate with, participation in social activities, participation in educational activities, participation in employment activities, legal matters, and any other matters, excluding financial matters. So some helpful hints when it comes to a personal directive. The least amount of people that you can put on there, the possible. I've seen sometimes where people feel that they need to put all 6 of their kids on there so everybody feels like they're part of the process, but that can be a lot when it comes to healthcare decisions. And it's also important, if you are going to name multiple people, the wording that you use and or. If you use and, it means we're just naming 2 people, for example, that both people need to make decisions together. If it's or, then one person can make a decision if somebody else is not able to be there or they can't contact them or something like that. It is easier if you're able to name somebody that lives in the city. Just if there's written consent or something like that, it can be time consuming if we need to make decisions quickly for somebody. But don't let this be a reason why you don't name somebody on your personal directive. And make sure to pick someone that you trust who's going to make decisions about what you want and not what they want. That's really important because I think sometimes people pick people because they feel like they should and not because it's the right person to pick. And it doesn't have to be family, it can be friends, neighbor, something like that. So it is really important to have conversations about your healthcare goals and wishes with your agent in order for them to make good decisions for you. I've been in situations where somebody's just named as an agent and they don't know what their loved one wants, and it causes a lot of distress for them. So if you have those conversations beforehand, that can really help your agent if they're in the situation where they need to make decisions for you. An enduring power of attorney. So this is a document where somebody can help make financial decisions, pay bills, all that sorts of thing on your behalf if you're in the hospital, if you're not able to on your own. Again, this is somebody that you trust. This document should be done with a lawyer. There's ways around it. You can buy packages at like your local registry's office and that sort of thing. And it's just a way, so like I've worked in other parts of the hospital before, and sometimes people's bills don't get paid because nobody can access accounts and that sort of thing. So it is important to have this done before you end up in the hospital or something like that. And the last part is a will, and this comes into effect after someone has passed away. This should also be done with a lawyer. However, if you can also buy packages at the local registry's office. All of these documents should be easily accessible to your agents should they need to access them. It's best if you have a copy and if your agent has a copy. If you have a green sleeve, you should also have a copy of your personal directive in there. The thing that I seem to come across the most is where people leave the original copies in a safety deposit box and nobody else has copies. it's no help to anybody if they're trying to get the documents to prove that they're an agent if the documents they can't access. So I would just suggest maybe not keeping them. If you do keep them in there, at least have somebody have a copy somewhere and know where the copy is. So I just have a quick video here to just talk a little bit about advanced care planning. And this is done by Alberta Health Services. So
Goals of care are designations used by your healthcare providers to describe the general aims of your healthcare and the preferred location of that care. Decisions about goals of care usually arise over time through conversations between you, your family, or loved ones and your healthcare team. The process of thinking about, talking about, and documenting your wishes for healthcare is called advanced care planning. In a medical emergency, your goals of care designation guides your healthcare team to provide timely care that is both medically appropriate and reflects your personal values and wishes. There are 3 general approaches to care or goals of care: resuscitative care, medical care, and comfort care. In resuscitative care, the main goal of care is to prolong life by curing or controlling your health condition. This means that doctors and nurses could use intensive medical and surgical interventions, if these are needed, to keep you alive and could be expected to cure or control your illness. If your heart stops, they may perform cardiopulmonary resuscitation or CPR. You may have seen resuscitation or CPR performed on television or in the movies. The person usually recovers easily, but this doesn't tell the whole story. Resuscitation measures like CPR work best in emergency situations where the heart stops suddenly, but the person is otherwise pretty healthy. It's important to know that CPR normally cannot restart the heart or restore life when the heart has stopped as a result of a severe or terminal illness. In CPR, the doctor or nurse repeatedly pushes on the chest with great force and periodically puts air into the lungs. Electric shocks, called defibrillation, may also be used to restart the heart, and some medicines might also be given. If the patient's heart starts to beat again, most patients require a stay in intensive care and a period of rehabilitation before they are well enough to leave hospital, and some people are left with permanent damage from their heart stopping. Resuscitative care can also include using medications and other treatments that are provided in an intensive care unit or ICU. The ICU is a very specialized unit in a hospital with doctors and nurses who are trained in using special equipment and medications to care for very sick people. An intervention that may be used in the ICU to prolong your life is a ventilating machine. These machines are used if you're unable to breathe on your own. This means putting a tube which is attached to a machine down the throat into the windpipe to push air into your lungs. Because this tube can be quite uncomfortable, people are often given medications to keep them very sleepy or sedated. You cannot eat or talk while on this machine. If you have a potentially curable or treatable condition, ICU care might be needed to help you heal. The hope is that you will return to your previous health, but it is important to understand resuscitative care and procedures used with the aim of prolonging life may or may not achieve that aim of restoring your previous health. In medical care, the goal of care is also to prolong life and to cure or control your health condition, but without the use of resuscitative care and the ICU.
Good morning, Mr. and Mrs. Johnson. How are you this morning?
Medical care can be appropriate if your health condition is such that intensive or resuscitative care such as CPR and a breathing tube are unlikely to work. Or your wishes and values about healthcare may be that you would not be accepting of these intensive medical treatments. For example, if they are unlikely to restore you to a state of health that you would want. In the medical approach to care, your doctors and nurses will provide tests and treatments for any treatable problems that may arise. This approach may include surgery and medical treatments such as blood transfusions, kidney dialysis, feeding tubes, antibiotics, and other medicines or fluids given through your veins. Most of these treatments mean going to the hospital.
Of course, you know how much she loves dance. Okay.
Hi,
So
Pat.
of course,
Good afternoon.
Some people want to receive only the life-prolonging treatments that can be provided in their home or in the care center where they live, even if this limits what treatments are possible. If your goals include a desire to avoid going to the hospital for treatment, talk to your doctor about what treatments may be available and helpful to you in your home or care center. When your health condition or your values and wishes reflect a goal of maximizing comfort and relieving symptoms, this approach is called comfort care. Your doctors and nurses will give you medicines and other medical treatments to help control uncomfortable symptoms such as pain, trouble breathing, or feeling sick to your stomach. The main goal is not to prolong life, it is to maximize your comfort. Resuscitative treatments are not used. Comfort care does not mean that you receive less care. It means the focus of your medical care is on quality of life and reduction of symptoms. People receiving comfort care are usually treated at home, in hospice, or in a long-term care center. However, sometimes hospitalization may be needed to provide optimum comfort.
You know, he feels a lot weaker when he can't keep anything down.
In the hospital, the approach to care will continue to be focused on providing comfort and relieving symptoms. It's helpful to keep in mind your wishes and to know about your own health condition when you are discussing goals of care. Resuscitative care, medical care, and comfort care can be divided into more specific subcategories called goals of care designations. These subcategories provide your healthcare team with important information to help guide medical decisions about your treatment. Talk to your healthcare team about which goals of care designation best reflects your wishes and health circumstances.
Yeah, goals of care basically just so you get a chance to speak with your healthcare provider about what fits best for you and your medical condition. These are fluid. Once you pick them, doesn't mean that it's set in stone. If things change, you're more than welcome to change them. If you end up in the hospital for some reason and you're not able to make decisions or speak to your healthcare provider about what's going on, everybody is assumed to be in R1, which is what you watched at the beginning, which is the ICU with CPR and intubation and that sort of thing. So just be aware of that. When you do get a goals of care designation with your doctor, make sure to have a copy of it. You get this green sleeve, which is also what I talked about to put a personal directive in. And it's just a nice way to carry around everything so they don't get lost. So you should have a copy, and also a copy should be at the hospital. When it comes to advanced care planning and goals of care, some things that are important to consider is making sure that you feel like you have enough information about your health care or about your illness, diagnosis, whatever it is that you're being faced with. Make sure to contact your healthcare provider, your family doctor, physiotherapist, whoever it is that's part of your care, to gather as much information as you can. The other thing that's important to consider too is what's important to you in everyday life, quality versus quantity, and all of that sort of thing. So to talk to your families about this and talk with your healthcare providers about it as well. If you're needing more information about goals of care and advanced care planning, they're kind of go hand in hand. You can go to Conversations Matter, which is a website that's part of Alberta Health Services, and they have more information and resources available if you're interested. And that's the end.